Health reporter Alicia Booth is here now with a look at a disabling illness that is very hard to diagnose and very rare.
Yeah, it's scary. It's a disorder so excruciating it's driven some people to kill themselves rather than live with the pain. But a Maple Heights woman is speaking out about it in hopes of helping others.
Diane Linston will never forget that first attack 4 months ago.
I was washing my face, and as I was drying my face, this real electroshock pain just hit the left side of my face. It was just unbearable. I wouldn't wish it on my worst enemy.
Diane would eventually learn she had trigeminal neuralgia, one of the most painful disorders a person can endure. In Diane's case, attacks have happened as many as 30 times in a day.
It is reported that over time there have been people historically that have committed suicide because the pain is that severe.
University Hospital's Colleen Tomsick is Diane's neurologist at the Bedford Medical Center. She says the disorder is often caused by a blood vessel bumping up against the nerve, which makes it fire incorrectly.
Other times it can be caused by blood vessel malformations in the area of trigeminal nerve, aneurysms, multiple sclerosis, and other things that are in the area that will irritate the trigeminal nerve.
Diane, who is a fashion designer, was just about to realize her dream of taking part in New York's Fashion Week when the disorder struck, completely disabling her.
I couldn't brush my teeth, I couldn't wash my face, I couldn't eat. For the most part, I just sat on my couch.
But she's worked hard to keep her spirits up until her doctors can find the right treatment. Trigeminal neuralgia is not fatal, but the drugs used to treat it can be. Diane has already had a dangerous reaction to some of the drugs, but seems to be responding well to her current treatment.
She has a really positive outlook, which is really helping us treat her.
For people who don't respond to medication, there's surgery, and that may be the answer for Diane. She just wants to continue her fashion design career eventually. And trigeminal neuralgia is a little more common than you might think. We don't hear a lot about it, though. It is very hard to diagnose, though luckily for Diane, her doctors knew right away what it was so they could get started on the treatment.
So diagnosing it is hard, horrible to live with, and it sounds like pretty risky treatment as well.
There are some people who do manage to live with it and get the right medication or the surgery, and of course that's what we're all hoping for Diane.
Absolutely. Thanks, Alicia.